Hi, good evening, everyone. I hope I'm audible, and I'm really sorry for the delay. Um, my name is Dr. Madhura Shah, and I'm gonna, first of all, congratulations to everybody on clearing your part one of MRCOG exam. And I'm really thrilled to take this session today because I'm gonna, first of all, meet so many new people. And I'm sure today we're just going to get a little more acclimatized and more familiar with the exam pattern of Part 2 MRCOG. Um, as we have given Part 1 MRCOG, we all know that we dealt with a lot of basics in Part 1 with a little bit of, clinical questions dabbed in here and there. But in Part 2 MRCOG, we have to realize that this is mainly a clinical exam. Okay, so most of I would say all of my questions are going to be clinical, except for a little bit of teaching, appraisal, auditing, and statistics that's involved. But don't worry about all of that. We'll tell you about it and help you. But what is important is to understand that this is more vast and this is slightly a little more, I wouldn't call it difficult because we have to realize that nothing is difficult in life. It's a bit tricky. That's the only thing that's a little different about this exam. So I hope everybody's eager to learn about this and let's begin. So first of all, today we will be talking about what the exam structure is, how the marks are divided. We will also learn when the college conducts this exam throughout the year, the examination fees, and they will depend on which country of, the country of your origin. And we'll talk about the eligibility, how to book the exam, what is the study material required, time duration needed to prepare for this examination, and what are the common mistakes which can lead to failure, and tips and tricks which can help you in the exam. Okay. So don't worry, I'm not going to take a lot of your time today. I'm just going to quickly skim over all of this that we are going to talk about today. If you all have any questions, please type it in the chat box. I will address all of them by the end of the session. Okay. And if I'm unable to address them at the end of the session, we will talk it out on the group. Okay. So moving forward. So first of all, as I mentioned earlier, this exam will test your practical application of your clinical knowledge. So in this, you have to know your obstetrics and gynecology well, apart from your basics. And another thing that is important is that this uh, exam will try to cover almost all of the whole of the subject of obstetrics and gynecology, thus making it a portion that is vast and extensive, which will obviously need more effort from your side and more study hours that would be need to be put in from your side as well. Because if we have to cover, like, let's say it's almost double or triple the portion of what we've read for part one. So the time needed and the effort and consistency needed for this exam will obviously be much more than what we put in for part one. So first, let's talk about the exam structure. The exam structure, first of all, this is not a paper-based test. This is a computer-based test. So as the part one is, and there are two parts. Like again in part one, there's a paper one and there's a paper two, and each paper is 50% of the total mark. Now this is something that you all did not face in part one, and this does remain a challenge for everyone to solve. First of all, we have the 40% single best answer. So that means the single best answers are wherein you're given four or five options and you have to choose the best answer. And then there are something called as extended matching questions. Now, extended matching questions will basically give you a clinical scenario, and they will give you maybe 10 options, or regarding that clinical scenario, A, B, C, D, E, F, G, H. Now let's take an example of this is a very vague example. Like if I'm just giving you a very, a rough example. Let's if the scenario is contraception, the topic is contraception, and in that they're talking about a patient who is, a past history of, she's a known case of let's say she's had a history of deep vein thrombosis and for which she's on warfarin, or she's on apixaban, or some rivaroxaban, some form of anticoagulant, and she's had, she has previous to cesareans, and again she underwent an MTP because she didn't want third baby, and now she's come to you for contraception. And then you're not going to have five options wherein they're going to tell you progesterone only pills or COCPs, or they're not going to give you five options. They're going to give you 10 options. It's going to be like barrier method, coitus interruptus, calendar method. Then they're going to give you COCPs, levonorgestrel. They're going to give you different permutation and combinations with the different doses. And then you have to choose the best, what you think according to that scenario. And for that, you have to understand that, okay, we have to treat it like a math question. You have to see, okay, she's fine, she's previous to LSCS. That's not really important, but she's a known case of deep vein thrombosis. She's on warfarin. So we understand that, maybe hormones will be problematic in her because, again, it's an enzyme inducer, enzyme inhibition. Then comes the concept of estrogen with, deep vein thrombosis. So all of this needs to go on in your head. And for this, for you all to solve these kind of questions, it is important that your basic clinical knowledge is strong. And that for this, you have to read the Green Top guidelines and the dogs. So that is where the whole, the challenge lies in this exam. And I wouldn't really call it challenge. I'd call the beauty of this exam, because that makes it a little more exciting to give this exam, because it's actually fun to solve these questions. So they are daunting, yes, but I think instead of looking at them, oh my God, I'm scared of solving the extended match questions, we're going to look at it, oh my God, yes, I will learn how to solve these questions and, practice more of these extended match questions. So I hope I'm clear about the two types of questions that they ask in this exam. As I said earlier, this exam is divided into paper 1 and paper 2. The duration of each paper is 3 hours, that is 180 minutes. Now, this exam is divided into 50 SBAs, that is single best answers, and 50 extended match questions. That will be in the first paper. And in the second paper, it will be again 50 SBAs and 50 EMQs. Another question that is asked is that what is the way they give you? Like, first of all, it could be your 50 SBAs could be obstetrics, then your 50 EMQs could be gynecology, or could be vice versa. So it doesn't mean that your paper 1 is obstetrics and your paper 2 is, what is it? It's not gynecology. It can be a mix up of both of it. Is that clear? Then another thing is that another important thing that even I faced when I was solving my mock exams for this was when there was a 70 minutes. There's a time that, how do you divide the time? How do you divide the 3 hours? Because your extended match questions will obviously require more time to read, more time to process the options, and more time to come to or deduce the right answer. So herein we have tried to divide it with 70 minutes for the single best answers and 110 minutes for extended match questions. After one paper, you have the lunch break, which is for approximately 60 minutes, which is followed by the next paper. Okay. Moving on. Now you have to understand that passing is a combined pass mark for SBA and EMQ. There is no separate pass mark for each. And this is determined by, the how all of those people giving that particular exam performs. So approximately SBAs are lesser, they contribute 40%, and EMQs contribute 60%. So this itself should tell you all that you have to conquer solving EMQs. Obviously, SBAs are going to fetch you the marks that you are. So our aim would be to not go wrong with the SBAs and to conquer solving EMQs. That should be your aim from from the beginning. Every time you read a particular GTG, or you read a particular talk, or you revise a particular topic or module, you have to know that, yes, I will solve my SBAs confidently, and I will also tackle my EMQs equally well. Okay. You have to understand that this is a standard setting. It is a well established procedure. There is no fixed pass mark, as I mentioned earlier. It varies based on the exam difficulty. Like for my exam, the pass mark was 65. The one which was held in July, the pass mark was 63. So it changes for each exam. Uh, the pass mark not disclosed before the exam. It is only thus you will get it on your answer when you get your result, that the pass mark was so and so and you have scored so and so. That means you either pass or fail. Aims to enhance fairness, validity, and set competence levels. So you have to understand that this is the exam where the college would want to get the best candidates. So they will screen you a little more with, they will screen you with a lens, and this is their way of doing it. And so you have, we cannot really calculate, oh my god, I've got these correct answers and these are right, this is wrong, because each exam will have a different pass mark depending about how the whole number of students who have given the exam have fared. Okay. Now the exam calendar. Usually there are 3 sessions, that is January, July, and September. However, for this year, there was January and July, and the next upcoming exam for part 2 would be the 22nd of January 2025. Now, the way you have to book it is also important. There's something when you pass, obviously, all of you will have passed the part 1 because that is the basic eligibility for giving part 2. We need to understand that you have to give expression of interest. So, now the expression of interest is basically a form that you have to fill online on the website, and you have to submit it, right? And you have to understand that this has to be done before a particular date. Now, if you're aiming for the 22nd of January, you have to submit your expression of interest by Friday 20th of September 2024. Now, another thing that is a little problematic here is when we express the interest, they do not give you an automated email back, because I did not receive. And I remember I was aiming for my exam. I had like expressed my interest a couple of times. I ended up filling the same form once or twice, but I had not gotten any email back. But later on, I got an email saying that booking window has opened and now you can book the exam. So that means that the expression of interest has, been registered with them. Booking window opens on Tuesday, 29 October, and booking window closes on 17 December 2024. Results released on 19th of February. They usually take a month's time to release their results. Now, I would want you all to understand this is that we have to, plan what exam you're giving, because now I am from Mumbai. I'm from India. I'm from Mumbai, and I wanted to give it in Mumbai, but however, I remember booking it like the exam window opened, and by the evening, all of Mumbai slots were done. So it depends from which country you come from, and the centers that are available, the preference you want for your centers. So you have to be pretty quick in booking the exam as well. Now, another rule is that if you want to cancel your seat, it has to happen before the booking window closes, because once the booking window closes, your money will be forfeited. College does not give you back the money unless you have given a valid reason that why you want to cancel, and that has to be before the booking window closes. Let's move ahead. Now, what is important is that the exam fee is different, and it depends on the country that you come from. For which country you belong to, you might know this from the part 1, but you can recheck. You can go and check your band A, B, C. Like India comes in band B, and our fee is it's £555, whereas for other countries it would be different. So you need to check that, and they're based on basically international membership subscription country bands. And so before you go ahead and fill up the form and the pay, you have to basically check which country your band belongs to. Obviously, as mentioned earlier, again, candidates have to successfully pass the part 1 Mrcog exam. I'm just going to quickly run you through the procedure of booking the center. No, I wouldn't say the center, the exam. So all of you all have a college number, and all of you all have a ARCOG account. You'll have to log in. You'll have to do the expression of interest within the stipulated time that they've given you. You have to look at the countries that it's available in. You have to select your city. And the Pearson, so they have a third party, that is the Pearson View Centers. They will help. You will be taken to that site. They will help you in booking that, and you will have to again choose your center. Like in Mumbai, they have Andheri, they have Kalyan, they have Thane, they have different centers. Then they have Pune, and it depends on that. Then you get to choose which center you want. Now, moving on to roughly telling you about the portion that we need to cover while preparing ourselves for the part 2 exam. First is the clinical skills. Then comes the teaching, appraisal, and assessment. This is something that is new to us because we don't really study it in our curriculum in on this part of the continent, and we um it's something new and it's interesting. And they definitely ask you questions, and these are very, they are very objective questions. If you know your stuff right, you know the definitions right, you can score marks here. So again, teaching, appraisal, and assessment is something that you should not study, but rather at least practice a few questions so that you get the questions right. Another part that we have to remember is that there's IT, clinical governance, and research. So unfortunately, statistics is something that they question you again on. We were asked about sensitivity, specificity, and we had to calculate that. So yes, we'll have to revise statistics for this exam as well. Ethics and legal issues, wherein about consents, about Fraser criteria, about contraception, abortion, all of these criteria will come in here. Core surgical skills. There will be something about laparoscopy, about instruments. This bundle of, it's called the surgical bundle that we will have to study. Post-operative care, fluid management, thromboembolic complications, prevention of VTE, ERAS, all of this will come under core surgical skills and post-operative care. Surgical procedures have to be clear. They do ask steps, and they will ask you about vaginal hysterectomy, abdominal hysterectomies, about cesareans, about anatomy, about arteries involved. Complications leading because of that, they will be included in that. There will be third degree, questions on third degree, fourth degree perineal tears, sutures used to treat, um what do you say, repair these tears. Now maternal maternal medicine, obstetrics we're talking about now. Antenatal care, the nice guidelines on antenatal care, nice guidelines for twin pregnancies, all of these are important here because what would we say, this is they so UK has a particular, so these are the number of visits that the patient should have. Where would the patient be? Would it be midwife led unit, or would it be a consultant led unit? That is another thing that is important. Triaging of patients, like is this patient a low risk patient, or is this patient a high risk patient? So they have these guidelines that they have put down, and they will question you on this. Like they will give you a scenario. This patient is, let's say, she's a multi-gravida, she's a previous normal delivery, but unfortunately her baby has, CP because the baby had a case of shoulder dystocia in the previous pregnancy. So where would you now want this patient to deliver? Would you want her in a consultant based unit, or would you still be okay with a periphery unit, which is, led by a midwife? So all of these questions you will be able to solve when you know that, okay, this guideline says this, that no, I cannot let this patient go to a midwife unit. She has to have a consultant led care to prevent the shoulder dystocia from occurring again. So all of these things will come to you once you start reading, or once we start learning these guidelines together. Okay. Then comes the maternal medicine. Maternal medicine is a very vast module. It's a beautiful module because it will include everything about hypertension. There's nice guidelines on hypertension. There's diabetes guidelines. They have beautiful guidelines. So I feel I've become a better clinician and a better obstetrician by reading all of these guidelines, because I practice these guidelines in my daily life now. So this exam is not only something that you will help in your resume or help you move towards your goal, but it will definitely make you a better clinician um, after reading this. Next is management of labor. Again, they have set guidelines when to titrate, when to titrate oxytocin, when to, do a fetal scalp monitoring, when to do intrapartum. They have beautiful guidelines over CTG, which have been recently updated. They have color coding for that. That's the latest guideline. Then there is management of delivery. They have ventus, or what do you say, operative obstetric deliveries. They have cesarean section. They have repeat cesarean sections. They have talks on cesarean niche. They have very vast, enriching material that we'll have to go through. Postpartum problems. There will be gapes or suture site infections is what we'll study about. Gynecological problems, again, like abnormal uterine bleeding. They have a beautiful, nice guideline on heavy menstrual bleeding, wherein they advocate putting in a LNG IUD. Then there will be subfertility. Subfertility is also something that is, they have very robust guidelines on that. Sexual and reproductive health, that the organization is BASH, and they have guidelines on gonorrhea, chlamydia, and BHIVA is the guidelines for the organization that gives guidelines for HIV. And, my country guidelines are different, your country guidelines could be different, but the British guidelines are different, and we'll have to read them because they operate at viral loads which are different from ours. They don't. So we'll have to learn all of this. Then we have early pregnancy care, wherein there's ectopic, nausea, vomiting guidelines. And lastly, we have urogynecology and gynecological oncology. Really good guidelines on SUIs, on incontinence, mixed incontinence. We will have to learn urodynamic studies here, how to read a urodynamic UDS study. Is it pure SUI, or is it a genuine SUI, or is it a overactive bladder? What is the guideline for overactive bladder? There is a certain what do you say, there's a certain way we have to follow. Like, first there's weight reduction, then comes in caffeine intake, smoking. You have to maintain a bladder diary. This is given wonderfully in the guidelines, and we're going to have to learn all of them. I know this looks daunting. This feels like, oh my God, how am I going to do it? But consistency and revision is the key. So don't worry, we'll all get there. So, what are the resources? Where am I going to read all of this from? So, this exam does have a very, what do you say, the myriad resources, and they are very, vast and, spaced out. So I think one important thing for this exam is to have your own study material, have your own crisp notes that can help you in revision. Because as I said, revision is again the key. We have talks, which are review articles from the obstetrician and gynecologist. This is the journal, and they have review articles which we can use. Green top guidelines, again, nice guidelines. Consent advices, BASH guidelines. FSRH guidelines are for the contraception. Scientific scientific impact papers, clinical governance and advice summaries. ESHA guidelines are the European guidelines for infertility. FIGO and BCGS oncology summaries, biostatistics, and clinical governance. Okay. We also have Embrace, which is the maternal mortality related. And they do ask you questions. So my exam had a question like, what is the most common cardiac cause of maternal death? And the answer is cardiomyopathy. So, they have different, like my continent has different, my country has a different most common cause of maternal mortality, whereas theirs have a different one, and we will have to learn to give their exam. What are the books? Now, the books that we use, we will help you with them again, are mentioned here. One is Justin Conjay, the other one is Rekha Guntal, there's Andrew Sizer. These are all books which will not only cover the SPAs, but also cover the EMQs. And EMQs, again, as I said, are equally important. Now, now this question time, what the basic question that everybody asks is, do we have enough time to this? Like I tell you all, that there is no set format. There, maybe I'll take 6 months, I'll take 10 months, I'll take a year to prepare for this exam. It depends on, first of all, what you're doing. Are you still trained? Are you experienced on which you are confident? So for would ask you all is what you all are doing. How much of time can you all spare to study every day? And or maybe you're a lecturer somewhere, or a consultant. Am I audible, guys? Just give me a thumbs up quickly if I'm audible. I think there was some issue with the meeting. It just refreshed itself again. Am I audible? Just quick thumbs up would help. Yes. Okay. Thank you, Minhal. So where was I? Yeah. So to answer the question, how much time do I require to prepare for this exam? I would ask you all questions in um. So what were the questions I was asking you? Yeah. First is, what do you do and what is your level of confidence on clinical skills, how much time you can give to study every day, again bold every day, and make notes, follow up, revise, and make your own timeline. We can give you a timetable, we can help you revise, we can do everything, but at the end of the day it depends all on you and how much time will you be able to dedicate and how badly do you want to clear this in the first go, because yes, um there is a higher failure rate in this exam compared to the first part. Again, I'm not going to try to dissuade you or not going to sound daunting, but this is the truth. We have to accept it. It's a tougher, again, not a difficult, I would say it's a trickier exam. Once you know your basics, once you know on the tip of your fingers what are the guidelines, what is done when, once you know the treatment algorithms, you can ace this exam. But you have to be able to do it consistently and every day. You have to be able to give time for it, and you know give your best in this shot itself. So I gave this exam when I was working as a senior resident, and I could have hardly give 3-4 hours in a day, but those were the best. That was the best I could do. I used to solve MCQs every day, be it like 5 MCQs, 10 MCQs. I used to, if I was like, I was sitting in a taxi and I was going somewhere, I used to solve MCQs. If I was sitting in my emergency in my labor room and, I was just sitting free, I used to open my iPad, go through my notes. So the answer to acing this exam is consistency. Okay. So again, to answer the question that is asked, what is the time duration needed? It is different for everybody. It depends on the dedication, time, and your confidence in your clinical knowledge and clinical skills. Okay. Moving on. Um, Common mistakes which lead to failure. Uh, First of all, I would like to tell you all that never be upset with the word failure, because failure is something that will teach you to be stronger. So I would not call it failure. I would just call it a learning experience. Every time you make a wrong decision, every time you have any difficulty in your clinical practice, or every time you have a difficult MCQ and you have a wrong answer, it is not your failure. It is a learning experience. You learn each day and you learn till the end. That is what this exam has taught me. Because every time I was, this is wrong, I was not upset. I used to go back, I used to look at the clinical guideline, and I used to feel, okay, this is where I went wrong, and train my brain to think in that way. So, first of all, this is the first lesson that I would say was taught to me by this exam, is that solve MCQs. If you're wrong, go back to that guideline, read it, and assess yourself why you were wrong. Second is giving too little time, or taking too much of time. If you're giving too little time, if you want to, let's say, jam it up in 2 months, it might be a little difficult. Secondly is, if you're taking a year to prepare for it, there has to be consistency, because you cannot give up in the middle, because we tend to forget these guidelines if we are not using it in our everyday practice. And again, the last mistake that I would feel is that not solving enough MCQs. This is what is important for any competitive exam, is what I feel, is that the amount of MCQs that you solve has to be a lot. Even I used to solve the same MCQ again, because we end up, see, the different resources that you use, the resources that we give you might have repetitive questions, but that doesn't mean you do not actively solve it. You have to actively solve it. Okay. Moving on. Again, tips and tricks, repetitive again, this might sound you, but consistency is the key. Crisp notes is a prerequisite, and revision again is something that will help you till the end. Okay, moving on. I would like to take this opportunity. Before I do this, I would want to call on Dr. Zaveria. She is our senior mentor with the Med Institutors, and I would please request her to share her, opinion and share her experience with her, because she's much more senior to what I am, and I would be honored to, and I'll feel humbled to welcome her here today. And first of all, thank you, ma'am, for being with us, and please share your experience with all of us who want to learn more.
Hello, everybody. Thank you so much, Dr. Madhura. I'm really happy to join you guys today, and I want to congratulate every one of the candidates who have passed their MRCOG Part 1. I think you have beautifully explained every detail about this exam, and I think this is an exam which is very fun to go through it. It seems very like you're going on a roller coaster, but you thoroughly enjoy it when at the end of the tunnel you find that you have achieved a very big milestone in your career. So I would not like to discourage anyone. I would like to encourage everyone to go for it and ace it. There are a few things I want to I feel like I should explain. And one of them is that, because this is an international exams, and we from all part of the world are giving this exam with different backgrounds, and we are at our we all are at different stage of our careers. Some of the people who are giving exams, they are in their residencies. Some are the ones who have already passed their local membership and fellowship exams, and they are going for an international degree now. Some of the candidates are the one which are already have a lot of experience, clinical experience. So you cannot confine its preparation to us to a single duration, that maybe somebody who already has a fellowship exam or a membership exam has a baseline background knowledge. So that person would need maybe 3 months or 5 months of preparation would be enough for them. But somebody who is in his or her residency, that person might need a thorough study, and making all the new concepts from the very start. So that person might need 6 months or 8 months or maybe a year. So I would suggest one thing, that please orient yourself that at which phase of knowledge you already have. If you have a good background knowledge, um, a little time is more than enough for you. But if you are a newcomer, if you're a beginner, please give it a good amount of time, and please go through it thoroughly. Don't think that if you are somebody who can study smart, and who has a very good past record of just solving MCQs and passing the exam, you can do this with this exam also. No, because if you have a good base and foundation in MRCG part 2, the part 3 will become very easy for you. But if you fail to clear your concepts in part 2, then that will be very much get evident in part 3. And then when you will reach part 3, you will realize that, oh my god, I have missed these concepts, and now I am being checked on these concepts. So actually, I really appreciate our Royal College for developing a very thorough exam which check your knowledge and concepts from every domain. And I think this is really appreciable. I don't think that any other college can have such a thorough scrutiny of your knowledge and your skills and your attitude toward the exam. So that is one point that I would like to say. And another point is that, as Dr. Mathura beautifully said, that please don't lose your heart if you could not pass it in one attempt. This exam is worth going, because at every steps you'll come to know that it will refine your knowledge, it will refine your concepts, and it will make you a very good clinician. And I think that's the beauty of this exam. And another thing is that, as she said, that you have to make your own notes. There are two ways of making your notes. One is, like me, like an old school person, I still go by paper and pen. But they are very the new generation, they're very good at iPads and highlighting the guidelines with on their iPads. So whatever your way of learning is, please make your own notes, because if you will only go by the slides, you might forget them. These notes will stay with you at least till you pass your MRCG part 3, and even after that, maybe in future you will be teaching your juniors, or you will be joining a medical college for teaching, or any other situation. These notes will stay with you, these guidelines, these all topics will stay with you. So the best is that you make your own notes and keep revising them, because we as a human, we have the ability of pictorial memory also. So sometimes what happens that you're solving an MCQ, and um a pictorial memory comes in front of you, and you recall, okay, that algorithm was going by this way, and this is the correct answer. So you need constant repetition. I think at least 4 to 5 times revision of a guideline is necessary to grasp it fully. So if this amount of revision is required, then you need to have your own notes, either in the form of, as I said, in the form of iPads, or in the form of paper or pen. I actually had to buy my own printer, because I was printing my guidelines and making notes on them. And one more thing is that please go by modules. Do not jump from one topic to another, and haphazardly organize yourself. If you like ops, you go by the ops modules first. If you like more interested in gynae, go from the gynae guidelines, and finish one module, and then um, start the second. And one more thing is, the one trick is that, for example, if you're going an antenatal module, you finished antenatal module, and then you go by the maternal medicine module, then don't stop solving MCQs from the antenatal module. Keep solving MCQs from all modules, because they will keep your knowledge fresh. They will you will keep going back to those questions, and recalling your like knowledge. That's very important. So even if you finish a module, keep going through its MCQs repeatedly, again and again. And as Dr. Madhura said, that assign a specific amount of questions daily for your revision and for your practice. Because what happens that when you're solving the paper, then it should be some EMQs are so long that they may take you 2 to 3 minutes just to read. And when you're reading them, you really get confused that, okay, the option C is also reasonable, the option F is also reasonable, and you spend another 2 minutes in picking the right choice. So actually you spend some more time than assigned for a question. So what is the point is that there should be some questions which are in one glance you see them, and you choose them, and you just save your time. And this is very helpful in your SBS, because in SBS some questions are only like one line, and there are four words beneath that, options beneath that. So in those questions you can easily save time. But that crispness always comes when you are good at practicing your MCQs. So never stop practicing. And sometimes what happens is that what mistake some candidates makes, that they, when they're solving MCQs, there are some MCQs books that are outdated, which have MCQs which are outdated, and they remember the wrong answer, and then they go and choose that wrong answer in the exam. So I would always suggest that once you have finished a module, then start solving the questions from that module. Like for example, I said antenatal care. If you're reading antenatal care module, then you go for the MCQs for that module. And then if you find that this MCQ in XYZ book is wrong, answer is wrong, please write there and then that new guideline says this, so that once again when you're revising that, you know that, okay, this is an outdated MCQ. So I think this is what I wanted to share, and I wish you all the best. But I would again say that please orient yourself and assess yourself that you are, because the only problem with this exam is that it is expensive. Like for most of us, it's quite expensive. The money we have to arrange for it is not small, especially if you are in your residency or early career. Then it's a concern. So please orient yourself that how much time would you need, what are your routines, what is your time available, and please be steadfast. And please, if some of you can manage to have a study partner, that will be a very plus point, because when you have a study partner, the things become easy for you. So if you can arrange a study partner, that's very good. I couldn't have a study partner, but still I went through it, and alhamdulillah, I was able to like pass it. But a study partner helps a lot, and make that study partner for part 2 and part 3 definitely needs a partner. So, all the best. And we are all here to help you. We will learn together. Nobody's perfect. It's a continuous process. Dr. Madhura is a very seasoned, mentor. And I think she would be a very good mentor for you. And the way she has explained this course, I'm very hopeful that you all will pass with her mentorship. And I wish you all the best.
Thank you so much, ma'am. Thank you for your kind words. I'm extremely humbled by your words today. And I just want to say that we all are learning, and this exam is a very beautiful learning experience for everyone who takes it. Whether the result is positive or negative, that doesn't matter. What matters is that it makes you a better person and a better clinician at the end of the day. And thank you so much, ma'am, for so beautifully explaining what her what her policies were and how she overcame them. Again, having a study partner is also very important, but do not be disheartened if you do not find anyone. Your own determination can also help you. If you have one, it's a plus point. If you don't, but don't get disheartened, okay? uh, Thank you, Dr. Zaveria, ma'am. Thank you for sparing your time and helping us out today. um, before we end the session, I just wanted to uh, tell what the team Med Institutor is offering y'all. We at Med Institutors are looking forward for hosting all of you all for the July 2025 exam, and we have a long premium course for it, which is a duration of 8 months, which will include live sessions. You will have the session recordings. There will be, as I said, the we have to conquer the EMQs, and that will be done with exclusive discussions. There is a module wise course, as ma'am highlighted, that it is important you learn this exam module wise. Daily topic and question discussion. Again, as I said, every day is the key word. TOG summaries, green top guidelines summaries, nice guidelines, consent, BASH, the contraceptive guidelines, scientific impact papers, clinical governance measures, FIGO. Again, what we are stressing on is the organization that is important. We will provide you notes, but having your own, may it be the old school way of writing stuff down, printing stuff down, or writing it onto an iPad electronically. Depends on you and how well versed you are with technology. But again, making your own notes is important. Um, we will be providing you all with flashcards, which are very important for visual memory. There will be sessions on biostatistics and clinical governance, which is what we are offering different is a mock exam, which will help you all to prepare for the D-Day. And we will also be providing you 24/7 Telegram support, which will help you through the app, obviously, and which will help you clear your exams. Those looking forward for joining the aiming the January exam, we will be providing you with a premium long course, which will again be for 3 months. There we will be providing a similar thing, which will be have wherein we will provide live sessions, written summaries, organized and dedicated schedule will be there. There will be help in the form of group mentorship. Uh, there will be updated. We will keep on updating all our sessions. There will be an important question workshop. Dedicated Telegram group will obviously be provided, and we will also we be giving appropriate references for wherever the exam questions are taken from, and so that there's no confusion on what is the right answer. So I'm at the end of our discussion, and I hope that we have been able to. So the aim of this session was basically to acquaint you all to what part 2 MRCOG is. It is definitely not a cakewalk, but it is it's just something that has to be done with dedication every day. And okay, if you aim for the January exam, I have to clear up my schedule, make a timetable, and study well for it. And we just wanted to, acquaint you all to the portion that is there. And the vastness of this portion is also something that has to be accepted, and something that has to be accepted and worked on upon. And we can cover everything. It is something that can be read once, twice, revised, and solved MCQs accordingly. So if you all have any questions, please do type in. Those who are interested to join the Med Institutors team can please contact Dr. Minhal and Dr. Sadia. They will help you with all of the details which you all will need, and any of the questions or doubts you all have. Okay, so I hope I was able to help you all. If you all have
Dr.
any doubts
Madhura,
and questions, please do ask.
there's a question in the chat box. Could you please check it?
Yeah, just give me a moment. I'm reading this question was, if course duration is 8 months, does this mean a course period is already ongoing and we need to only join in November for July, or we're still able to start the course now for Jan 2025? For the Jan 2025, you can contact the team. They will let you know when the course begins, and we will also be putting out the dates for July 2025 as well. Now, if you join in for the course of Jan 2025 and somehow you decide, okay, no, I don't want to give the one in January and I want to give the July attempt, we will help you out on, figuring out how the course can be extended, or how, your revision can help, can be planned. So for that, do contact the team. They will definitely help you out with it. Dr. Neha, is 5 or 6 months, she's asking basically, is 5 or 6 months enough for preparation while, is enough to clear part two exam while working as a consultant? So now you're already a consultant, so you already you're going to be confident clinically, and knowledge will be good enough. What we have to, um plan is that, would you be able to give enough time and the dedicated hours every day to study for this exam, and be confident enough to appear for this exam? That would be the first question that I have, and that I would ask you to ask. It's an introspection that you'll have to do. 4 hours per day would be enough, but again, we have to understand that, this is not a math. There's no set guideline that, okay, this is the time that will be required. It is person to person. It is, as we say in our clinical practice, that the management is case based. I would say here that your decision to, the amount of time needed would be solely based on you. If you're someone who is comfortable with solving MCQs, who is, comfortable with reading every day, revising. But if you're someone who takes a lot of time in reading the questions and understanding the questions, that has to be something that maybe we can help you out with. If you share your doubts and your this with us, you can contact our, the team at Med Institutors. They can help you out with it. But again, this question that everybody tends to have in mind is, do we go for the January exam or do we go to the July exam? As Dr. Zaveria said, that we are not dissuading anyone to not appear for the January exam, or we are telling you we need to appear for that. You have to understand that, okay, yes, minimum 5 to 6 months is needed, but again, if you're someone who's not doing anything, who can say, who's in between jobs or in between courses, and who, okay, let's say, is at home and can maybe study 12 hours a day, you might need lesser amount of time compared to someone who's studying, let's say, 5 hours a day. So maybe you can contact someone from the team and they can help you out to plan you know your schedule or how you're doing. But I think 5 to 6 months would be okay to give it in January. Um, thank you, Dr. Neha. I hope I could help you out. Another thing that you have to understand is that before any exam that we give, um, like, I'm someone who, I can't gauge if I'm ready for this or not. But I am someone who's, if I've made my mind that, okay, I have to give this attempt, I will give it a nod. So when I was giving my part two, I was also getting married during the same period of time. So it was a lot of jumble that was happening. And I remember calling up a friend and asking him, should I do this or should I not? Because the booking window is closing. Do I get, bring my application out and do I ask for a refund? And he was like, you just do it now. You're in it, just do it. And so that's what it is. You have to decide and you have to work towards it. And then I was like, okay, fine. I've already booked the exam. I will work towards it because I was not confident that, okay, will I be able to appear for it? Will I be able to give my best? But then, you have to play with your mind because every time you say, no, okay, I'm not prepared for this and I will take more time, you're playing with your mind. You're giving your mind an option that, okay, maybe I have more time to prepare. But then even after 5 months, you're going to be still that scared to give that exam. So this is something that is, it is different for everybody. We can help you out with, our team will talk to you all regarding your doubts and, helping you out helping you figure out what to do and what is best according to your plan and curriculum. But again, at the bottom line is, it is your decision. And someone who's completely ready to do it can do it in like 5 months. Someone who has a baby, who has responsibilities, who needs, maybe cannot give so much of time, will maybe take a year. So this is again something which is a very personal thing, but the team at Med Institutors will definitely help you figure it out. Um, so if you have cleared part one after MBBS, so I completed my, my post graduation in obstetrics and gynecology, and then I appeared for it. I had given my part one when I was in the first year of my course, and I had waited out a bit to give this exam because when I started reading about this exam, I realized I do not have that amount of clinical knowledge to give that exam. So I wouldn't say is it worth it if you feel you are confident enough, or if you feel you can, maybe get that amount of clinical understanding, or if you're already working in a setup which is mainly obstetrics and gynecology, then maybe you can do it after your MBBS as well. But if when you ask my personal opinion, I had done this. I'd waited out to complete my post graduation and then I had given my exam. Are there any more questions? No more questions, guys. Okay. So I hope we didn't scare you with the amount of uh the modules we showed you all on the slides. Trust me, guys, it's super fun. It's super fun reading their guidelines because the British guidelines are really awesome. I love British guidelines. I always refer to them whenever I practice in India today. And I think what they have is really, really good, and the amount of guidelines they've made and the collection that they have is robust. So preparing for this exam itself is, as ma'am said, is a roller coaster ride, but it's a fun ride. So don't get, boggled down with the amount of information that we've given you today. It's baby steps towards the goal that you'll have set for yourself. Okay, remember this. Uh, as I'm sorry, I'm not sure how to pronounce the name correctly, so I kindly apologize if it's wrong. But then we if you are working in the NHS, you might already be familiarized with most of the guidelines. So I think you can give it a try. But again, if you feel that you will not be able to give in it a lot of time, you might as well start preparing for something. Like you can start preparing for Jan 25 and then gauge when the exam booking date comes nearer, is what actually even I had done. So books we will be telling you about. There are a lot of books. EMQs are different, SBAs are different. Again, as ma'am said, the answers do have errors, as Dr. Zaveria had mentioned it. So yeah, you have to read the Green Dot guidelines and not just blindly. You face the same problem in part one as well because the books don't update at the same speed as the guidelines do. But uh, we'll tell you the names of the books. Don't worry, Neha, because there's a list. I'm not gonna. That's great. Thank you, Bamdele. Thank you. I hope it helps you out. Any more questions, guys? Thank you. Thank you, everyone. And I just want to, give out all of my positive energy and best wishes to everyone who is, beginning this journey for completing their part, part two, part three, whatever. And best wishes. And it's a fun ride. That's all. Thank you so much, guys. And I also would like to thank Team Med Institutors for giving me this opportunity to talk to you all and interact with you all today. And also, I would like to thank Dr. Zaveria for giving her opinion and for sharing her experience of part two and basically making time for us. Thank you. Good night, guys.